Welcome to our podcast, where we explore fascinating stories and ideas from various fields. In this episode, we will discuss how traumatic events, like earthquakes, can impact women's menstrual cycles. Earthquakes are known to wreak devastation on food, buildings, the economy, and the lives of those affected, besides mental health. But now, a new study has found a physical side effect of the natural occurrence, one that only affects women. Researchers have found that a woman's menstrual cycle also takes a hit due to a traumatic event like an earthquake. Menstruation is linked to hormonal fluctuations and involves the shedding of the uterine lining around every 27 days when the egg does not fertilize. When the monthly cycle follows a basic pattern, it indicates that the woman is healthy. However, when it starts to fluctuate or causes more than normal pain or blood flow, there is most likely a problem that can either be physical or mental. The corresponding author of the study, Sibel Kiak of Necmettin Erbakan University, Turkey, said in a statement, "Earthquakes can disrupt not only physical but also hormonal and psychological balances, which can directly affect women's reproductive health." Published in the scientific journal Brain and Behavior, the study specifically talks about women who witnessed two major earthquakes in Turkey who are now likely facing disruptions in their menstrual cycles. The study had 309 participants aged 18 to 49 who lived in the 11 regions declared as disaster zones after the February 6, 2023 earthquakes in Kahramanmaraş, Turkey. Measuring 7.8 on the Richter scale, the earthquake killed more than 50,000 people and injured over 11 lakhs. Nearly 38,000 buildings collapsed in the province, and there was immense pressure on the resources. They were asked to list the physical and mental side effects of the event 9 months after it happened. The study found a significant rise in the number of women suffering from menstrual irregularities. At least 14 points. 3% of the women had irregular cycles before the earthquakes, while 44.8% reported going through it afterwards. The problems listed included 14.6% of women reporting infrequent cycles after the earthquakes, 12.3% with heavy bleeding each month, 10.7% saying their periods had become overly frequent, and 10.7% reporting bleeding in between their periods. Shockingly, 22.7% of these women were found to be suffering from post-traumatic stress disorder, hinting at a link between irregularities and the trauma. Post-traumatic stress disorder can be triggered by even one traumatic incident. However, the study group did not represent all groups of women, as it required them to be literate and have an internet connection. But the authors say they noted that the trauma had influenced the hormones and therefore reproductive health. Thanks for tuning into this incredible story. If this episode resonated with you, don't forget to hit the like and subscribe button for more captivating stories to come. Stay tuned.